I felt something was wrong.
Endometrial cancer is the most common gynecologic malignancy in the United States, affecting over 66,000 women each year.
The biopsy came back cancer.
Endometrial cancer starts in the endometrial lining of the uterus, and usually by the time it's diagnosed, it's stage 1, which carries a very good prognosis. If it has spread past the uterus, it's more serious, and in that situation, we call that stage 3 or 4 when it's spread past the uterus.
I went to see Dr. Black in May of 2020, and she did an exam of me and everything, and she told me that it was what was going on, and she said it was stage 4.
This was a global clinical trial, and Willis Knighton participated in this trial, and we actually enrolled the second highest amount of patients in this trial in North America, which is really a big deal for our patients, especially with the findings from this trial that we believe will change the standard of care.
My sister had ovarian cancer and she died from it. And I said, I'm gonna fight this for her and prove to her, let her know that I'm still here, I can still be here to help take care of her son.
This trial has been described as a home run in terms of clinical trials for the reason being that it showed such a drastic difference in the patients that were able to have the immunotherapy versus those that did not have the immunotherapy.
Cancer-free for 3.5 years now. Dorothy
has a lot of hope for her future. She has done so well and has had very little side effects from the treatment. And I'm very optimistic about her prognosis and about how she will do. And I firmly believe that that is because she's had access to this clinical trial.
It's a very good treatment. I wasn't afraid. It's not harmful or nothing. I don't have no side effects.
To become the standard of care, you have to, a medication or therapy or device has to go through the process of a clinical trial. And these clinical trials really bring to people cutting-edge therapies many times that will change their life, hopefully save their life.
It saved my life.
I think this is a really exciting time because we now have excellent clinical trials available to our patients with gynecologic cancer, and every day we're opening new trials. And so this shift toward giving our patients really great clinical trials is going to give more and more women hope. It's going to make us a much stronger medical community, and it's going to help the next generation.
I was nervous at first, but once they got to talking to me and telling me all about the trial and everything, I had faith in them that they were looking out for me, and they did. They did just what I prayed about.